The pandemic threw a spotlight on serious inequities that are suffered by some populations. Black, Hispanic, and Indigenous Americans, for example, suffered a 3 to 4 times higher rate of infection and death from COVID.
That's Dr. Nwando Anyaoku, and she was giving that TED Talk. She is the Chief Health Equity Officer at Providence Swedish, and she joins me now to talk more in depth about health inequities and what Providence Swedish is doing about them. So you, from what I understand, are the first Chief Health Equity Officer at Providence Swedish. What does it mean, and why is this role so important?
Thank you for having me to have this conversation today. We've known for many years, decades actually, that certain populations don't experience our health care in the same way. They're underserved, marginalized populations for whom the access, the experience, and the outcomes are significantly different than from the majority populations. And in the wake of the pandemic, that really was a forcing function for a lot of things. One of them was that the data started to show really clearly to everyone beyond the healthcare system that there is a gap. And there are people for whom what we're trying to do and serve best is not, landing in the same way. And so Providence Swedish made a decision that they needed a clinical leader to really focus on the way that our healthcare was being experienced and received by the populations that we serve. That requires understanding the data that says who are we serving and how are we serving them? How are the outcomes for them? Do they have the same access to us? Do they go through our systems in the same way? Do they have the same results that everyone else is having? And really, if you think about health, the impact as a whole, without really looking at subpopulations, you might think that we're doing really great.
Right.
But, the health equity lens really asks us to break down the populations we serve and say, well, we're doing great across the board, but for this group, what does it look like? For that group, what does it look like? And that's what my role is.
And that's what is important in creating a healthy society as a whole.
Yes.
And having somebody on the inside. I mean, we've known for years the disparities in Black women in birthing rates. Yeah. But like you said, the pandemic, it really made people stand up and take notice and say, oh my gosh, this is a real problem. Tell me more about what are some of the other inequities look like and who do they affect?
I'll start with who do they affect. Because sometimes people think that it's a biology problem because people who have disparities in health outcome tend to be minority populations, so Black, Indigenous, and other people of color, Latinx populations, but also people who are marginalized for other reasons, such as the LGBTQI population, who may not feel comfortable accessing care in the same way. And really it's not a biological issue. It's an issue of other societal inequities. So do those people, they have a higher rate of poverty, they have a higher rate of different education, different access to healthcare. And in our country, healthcare tends to be linked to employment. And so when you have a higher rate of unemployment and things like that in those communities, then it starts to be like a proxy for it. Yeah. But really, they're not biological differences, because even for African Americans who are at higher socioeconomic status, they still experience some of those inequities. And so there's a lot more involved in how these inequities come to be. They really are a function of historic structural racism in our society. And so this is what we start to uncover as we look at our data, listen to stories, and understand really who we're serving and how we're serving them.
Wow. So it's your job to look at all that data and then say, okay, what do we do with it? And how do we serve the people best that we can? What are some of the ways that Swedish is addressing this?
So I say it's my job to really bring everyone's attention to it, because there's a lot, right?
Yeah.
And the good thing about healthcare is that you're working with a group of people whose mission, whose purpose is to bring their best selves and to help people.
Save lives.
And so, when you show people data and say, I know that your intention is to do well, but look at what this looks like. They come along and they're partners and they say, what can we do differently? How can we partner with you? Yeah. And so, I look across our different service lines, different partners, and look at different data sources and see gaps. Yeah. So with our primary care partners, for instance, we look at the metrics that we measure, which we have to measure on a regular basis. And we're like, oh, we look at how we perform for hypertension. But when we filter it by race, ethnicity, and language, we find out that for the African American population, there's a gap. We don't have as good control in hypertension. So I share it with my partners in that space and say, hey, look at what we're seeing. What can we do differently here? Likewise, with our Cancer Institute, for instance, we look at African Americans or Latinx populations who may not have as good access to screening, early mammography, and we say, hey, look at what our data is showing. What can we do differently? And so we come alongside. We have navigators who in language can connect us to the community, and we work with our Cancer Institute mobile mammogram van, and we go out to the community where those communities live and try to improve access.
And what I love that you do there, once you're out there, it's not just, okay, here we've got this, but we give you the next steps as well.
Yes.
I can't tell you how grateful I am for getting to talk. I mean, you have so much information and so much knowledge, and I just can't wait to talk to you more about this. So I appreciate every moment of time you've given us today.
Of course.
All right, well, for more information on the work that Providence Swedish is doing to improve health equities, you can just go to the website on your screen. That is the Office of Health Equity, Diversity, and Inclusion. So check that out right there.